about that kind of helps to stabilize things. Here's a picture. This is the labrum. It goes around basically the whole. This is the humerus. This is the glenoid, or the socket portion. And this is what it looks like if you were going to look straight away. It's this nice little ring. You can get tearing in several different places, and that can lead to pain. And so the best way to diagnose this after inspection and we're concerned that it's a labral problem is an MRI, where you actually have to put contrast in the joint and get the MRI. Okay? So hopefully you don't need this, but this is so much better that we have all these tools now at our disposal, because we don't have to go in and look around in surgery. We can actually know before what the problem is. So here's how you would fix it. This is an example of the front part of the labrum being torn off. You basically put some anchors, you put some sutures. Do this all arthroscopically, usually for about 3 or 4 small incisions, which is pretty awesome. And then up here, that's a slap repair. That's where that biceps is pulling away in internal impingement. And don't worry, it took me like 7 years to understand this in medical school, so I don't even have to worry about it. It's a little confusing. But those are all the things that are inside the shoulder related to the joint surface and the stabilizing ligament. So again, we talked about the rotator cuff, we talked about instability, we talked about labral problems, and related to pain with throwing and pain after throwing. What is little leaguer's shoulder? Well, that's a very interesting phenomenon. I see this a lot, especially as we get more into the baseball and overhead athlete and softball throwing. I'll have kids that come in, they're usually about 14, sometimes 10, sometimes a little older. But the key here is it's a kid who is not finished growing. So you have an open growth plate, and that's normal. I'll show you a picture. And if you look here on that slide right there, this is not a break in the bone. This is called the growth plate of the humerus, the arm bone again. And because that is a little bit weak, because the cells are growing and allowing you to get taller and allowing the bone to get wider, it is very sensitive to all of the torque and the force that is required when you throw a lot. So a 12-year-old kid who's just throwing his brains out all the time, and he's on 3 traveling teams and never had a break off, all of a sudden starts having all this pain. And it's kind of like they shake it off, they think it's going to go away, but it just doesn't seem. You get an x-ray and you have widening, because it's essentially like a stress fracture in the growth plate. It's causing too much stress, and so it's pulling it apart, okay? The good news about this problem, it gets better. And over 90% of kids who have this problem will go back to their pre-injury level of play. If they just rest it, and it's 3 months. I tell people, they'll throw in 3 months. That's just the way it is. I mean, there's no cheating, there's no, oh please, it feels better. And then you start going back through what's called a Thrower's 10 program, which, when I send you to the therapist, they teach you how to do. And it's a gradual return to play once all the symptoms are gone and you've had that rest. And that is something that it's a fantastic treatment, because it doesn't require any surgery. You don't need a cast, you don't need special medicine, you just need to rest. So just to wrap it up here, a few things about the elbow, because the elbow is an interesting structure. Now, it's a hinge joint, right? It doesn't have the same degree of mobility that our shoulder is, but it's also like the slingshot when you throw. And a lot of pressure and a lot of force is generated at the elbow with throwing. So we're going to talk about little leaguer's elbow. You got to say that fast again. The ulnar collateral ligament injuries, that's the Tommy John for all the baseball people here who love that stuff, and then some loose bodies. So same concept here. The elbow has growth plates. It's a little more complicated than the shoulder, which is just one. There's several growth plates that expand and help different parts of the elbow to grow. Through repetitive stress, the ligaments pull on those areas, and it's like fracturing it, and then the bone tries to grow, and then it pulls it. So again, the same idea, and it's always tender in the same spots in the elbow. You touch the kid, and they're just like, wow, that really hurt. How'd you know where it was going to hurt? I'm like, well, because I looked at your x-rays, and I just, it's a little magic involved. Not really, it's no magic. But this is something, the good thing is, this will get better too. You just got to rest. You just got to chill out, and you're going to be fine, and you're not going to need surgery. So, but I have a lot of cheaters in the audience sometimes who, they go back to playing and they wonder why they're not getting better. So I have to really, you gotta stay on it sometimes to really rest. So what is an ulnar collateral ligament injury? And this is just for completeness. This is like, the baseball players, and like, oh, season-ending injury, or the ones where they have to be out for the rest of the season. this is what happens. Essentially, valgus is a kind of a bending motion. So if you look at the elbow like this, it's supposed to be a hinge joint like this, right? It just hinges back and forth. But pitching requires this unnatural force this way. Your elbow is not supposed to go this way. It's just supposed to go this way. So this ligament here gets stretched out. And so you'll feel somebody and you twist them and oh, they just light up with pain and they bend. And that's not good. And so through repetitive stress, you can disrupt this completely in half, or you can just really injure it. This was, here's an example, just a picture of the elbow with the ulnar collateral ligament disrupted. And then how do I diagnose this? I get an MRI, and you can see right there that it's completely disrupted. In most people, in me, I do not throw competitively. I could be fine if I didn't have an ulnar collateral ligament, and I would never need it. But if you're a competitive thrower in any kind of overhead, this will really bother you, especially in a pitcher. And this was made famous by Tommy John. Now, he didn't do the surgery. He's the guy who had the surgery done on him. And the guy who did it was a surgeon in California named Frank Jobe. And I actually trained with Frank Jobe's son, Chris Jobe, out in California. So this was a long time ago. This, I think, was in 1972, I believe, that he had the surgery done. And they reconstructed the ligament and called it the Tommy John surgery. So it really is something that is reserved for people who are skeletally mature and somebody who is a competitive pitcher. Those are really, most of the time, the only person that needs this surgery. And the other thing is, if it's not completely torn, and even with some tearing, with rehab and rest, it oftentimes will heal on its own. Okay? The last one is the infamous loose bodies in the elbow. And this is just from people who beat up their elbow for a long period of time. Pieces of cartilage break off, little pieces of bone, and all of a sudden, oh, they literally get stuck and they can't move their elbow, and then it'll kind of move out of the way and they'll feel good. But it will directly relate to how many loose bodies and how much pain. And the good thing for that is that also is, it's not good that it's a surgery, but the surgery is very successful. You just basically have to remove the sand in the ball bearing and you get better. So that is essentially kind of a crash course on shoulder and elbow injuries and in the overhead athlete. And like Dr. Heaton very accurately and adeptly stated, the big thing here is these are injuries related to overuse. These, in our current kind of society, it's like we used to play soccer and then baseball, or we used to do this. Now it's like because of the level of competition, people are playing 12 months and they're playing all the time. And kids aren't designed to have that kind of stress on them. So the importance of pitch counts and of watching for injuries, and that, in my mind, is what's going to really decrease the overall injury patterns, is if we're cognizant of this issue. So I'm not going to go into all the pitch count stuff he already did, but essentially, if we can adhere to our kids and them responding to us, and them being able to honestly tell their coaches and their parents when they're being pushed too far, we can drastically decrease a lot of these types of injuries. Okay? Anybody have any questions? And if you do later, that's fine too. Yes?
How do you determine if the child is just saying I got a sore arm because it's a good team he's facing versus...
Right.
I know we're not MDs or anything like that, but
sure.
you gotta, and you also have a parent on your shoulder saying that, why is my kid pitching?
Yes, yes, that's a very good point, and I will have that oftentimes, that discussion when I see kids, and I have this sense that they don't want to be cleared to go back because of some other reason. Maybe they're being pushed too hard, or maybe, but then they also want to save face because they don't want to quit. So it requires a lot of transparency and honesty with your kids, and them being able to be honest with you as the coach or the parent, saying, I don't really want to play, but I don't want all the other kids to know that. And them having the freedom to maybe withdraw themselves. But you're right, they could just say they have shoulder pain. But I think if we err on the side of protecting them when they say they have pain, that's probably better than forcing them to play through the pain. Most kids that I see too, they want to play through the pain for the most part, you know. So that in my experience has been the opposite. I've had to like put the reins on them as opposed to me, you know, saying you're good and kick them out the door.